Good day, everyone. I'm here to present a research study that tackles a critical issue facing Baguio cities: the vulnerability of its urban infrastructure to climate change. With increasingly intense typhoons, unpredictable monsoon rains, and frequent flooding, our city's sanitation system are under immense pressure. This study explores how upgrading the Baguio City Sewerage Treatment Facility can significantly improve climate resilience, protect public health, and support sustainable urban development. The title of our study is Enhancing Climate Resilience Through Infrastructure Upgrades: The Case of Baguio City Sewerage Treatment Facility, conducted by Anulab Liwanag, John Loiter Dugui-es, and Christopher Ramos from the University of the Cordilleras. This research focuses on improving Baguio sewerage infrastructure to address climate-related risks. The abstract of our study is: the research examined how upgrading the city's sewerage treatment facility can enhance the climate resilience. The current system serves only 10% of households, leaving most of the population vulnerable to sanitation-related hazards. The facility will expand its capacity by 40%, reaching 12,000 cubic meter per day, and introduce decentralized treatment nodes. These upgrades aim to serve previously unconnected areas and reduce overflow during heavy rains. The study covers technical, environmental, financial, and social dimensions. It uses pre-feasibility data, stakeholders interviews, and global resilience frameworks to assess the project's impact. To provide targeted recommendations for integrating climate resilience into urban water infrastructure planning, the findings are intended to guide Baguio and other climate-sensitive cities in sustainable development. Next slide, please. So for the introduction of our research, Baguio City is increasingly affected by strong typhoons, heavy monsoon rains, and urban flooding. These events threaten public health, water quality, the city's economic stability. Over two-thirds of household discharge untreated sewage into waterways. This worsened downstream contamination and increased the risk of flood-related disease. Uh, Executive Order Number 94-2024 created a technical working group to align city development with the United Nations Making Cities Resilient 2030 program. The goal is full disaster preparedness and sustainable growth by 2026. Current facility status is that the Baguio City Sewerage Treatment Facility, or BSTF, built in 1986, has a limited capacity of 8,600 cubic meters a day and is frequently overflows during storm, releasing unrelated effluent into the Balili watershed. Upgrading the sewerage infrastructure is central to improving water quality, reducing disease, and building resilience. The city partnered with the Cities Development Initiative for Asia, or CDIA, to conduct a pre-feasibility study in 2016, guiding short and long-term investment in sanitation and flood control. Our next presenter is Mr. Jen Later Dugois.
Good day, everyone. I am John Dugui-es, and I will be the one who will discuss about the background of our study. To begin with, Baguio City's wastewater management challenges are being amplified by climate change, which brings heavy rains, intensifies urban flooding. This not only damages infrastructure but also increases public health as floodwater mixed with untreated sewage. Currently, around 66% household discharge wastewater without proper treatment, directly polluting the environment. The city's sewage treatment facility, already operating beyond its capacity, frequently overflows during heavy rains, releasing inadequate treated wastewater into nearby waterways. This has contributed to severe pollution of the Balili River, which fails to meet safe water quality standards. Recognizing these threats, the city is now aiming for adaptive, decentralized, and nature-based wastewater treatment system. Such approaches would help distribute the load away from a single overburdened facility, integrate green infrastructure to manage stormwater, and strengthen the city's resilience against climate impacts. This research is grounded on understanding these problems and exploring solutions that can protect Baguio's environment, safeguard public health, and set an example for urban area facing similar challenges. Next slide. Why is it a problem? How bad is it? Inadequate sewage treatment facility cover only 10% of the city. There are many reasons why this is a major problem, but it can cause water pollutions. It can cause water pollution rivers, and even wells are contaminated with harmful bacteria like E. coli, making water unsafe for humans, animals, and agriculture. That is public health risk. It increases cases of diarrhea, skin infections, and wasteborne diseases, especially during rainy seasons, which in Baguio City it is worsened to flooding because of some of our sewage is not treated well. Next is worsen flooding. When rainwater mixes with sewage and clogged drains, flooding spreads contaminated water into streets and home, which is sometimes it is really unsafe, especially if there are bacteria roaming around the water. For immediate issues, overflows during rains, overcapacity. Oops, sorry. Overcapacity of the Overcapacity at the sewage treatment plant, the STP is taking in more wastewater that it can process daily. So untreated or partial treated sewage ends up in river. Next is, of course, river pollution and health risk. Rivers like Balili and Galiano already have fecal coliform levels far beyond safe limits, posing risk for communities downstream. Next is, of course, foul odor in the cities. Locals report sewage smell in parts of downtown and during rainy weather when drains overflow, especially in the part of, what area is this? At Malcolm Square, if you're aware of that. Next slide. For, for, for our objective, this study is significant because it addresses urgent environmental and public health concerns in Baguio City. The current sewage challenge contribute to river pollution, groundwater contamination, and spread waterborne diseases, such as water disease such as it takes tackle pollution control, improve sanitation, and flood risk reduction. By improving wastewater management, we can protect natural waterways, reduce the overflow of untreated sewage during heavy rains, and create a cleaner urban environment. Beyond Baguio, the findings can serve as policies model for the cities with similar vulnerabilities, especially highland or tourism-driven communities facing rapid growth and limit, limited over limited sewer infrastructure. Ultimately, the study emphasizes the urgent needing for sewage system improvements not only to meet current demands but to ensure long-term environment sustainability and public health protection. Of course, why is the study significant? The study is significant because it addresses urgent environmental and public health concerns in Baguio City. The current sewerage challenges contribute to the river pollution, like the Balili River, which is our main river in Baguio City to Trinidad, groundwater contamination, and the spread of waterborne disease, issues that directly affecting the well-being of residents and visitors, not only the residents, not only the people, but also animals and its agriculture. It also tackles pollution control, improved sanitation, and flood risk reduction. By improving this, we can protect natural waterways, reduce the overflow of untreated sewage during heavy rains, and create a cleaner urban environment for the safety of people and animals, and agriculture. Beyond Baguio, the findings can serve as policy model for other cities with similar vulnerabilities, especially highland and tourism-driven communities facing rapid growth and limited sewer infrastructure. Ultimately, this is the study. This emphasizes the urgent need for sewage improvements, not only to meet the current demands, but of course to ensure long-term environment sustainability and public health protection. For our literature review, methodology, and data analysis approach will now be explained by Mr. Ramos Christopher.
Our study is supported by a few sources, such as, according to UN Habitat in 2022, cities need to move from reactive disaster response to proactive resilience building, using nature based solutions, decentralized systems, and stakeholder driven planning. Researches by Herman and others show that the untreated sewage worsens waterborne disease outbreaks, especially in flood prone areas. This highlights the urgency of modernizing sanitation, infrastructure, and effective wastewater treatment facilities that directly impact environmental health and disease control. To fund such improvements, blended finance models are crucial. Next slide, please. The OECD climate reports in 2023 cite cases where concessional loans and grants reduce fiscal risk while leveraging local revenue, such as environmental service fees. For Baguio City, studies by ICF Consulting Services in 2016 and recent updates from the City Council in 2024 reveal gaps in sanitation coverage and the need for both centralized and decentralized systems. The city's alignment with Making Cities Resilient 2030 framework and Executive Order number 94 in 2024 provide strong policy and institutional support for adaptive infrastructure. Next slide, please. This study used a descriptive mixed method approach, combining quantitative data like wastewater flow, coverage, and flood frequency, with qualitative insights from stakeholder interviews. Environmental data came from drainage channels linked to the main sewerage treatment facility and pilot decentralized sites. Next slide, please. We used GIS mapping for visualizing wastewater volumes, flood patterns, and water quality, while NVivo helped identify key community concerns, infrastructure priorities, and resilience strategies. In short, the results will guide targeted investment, align with international resilience standards, and improve both sanitation coverage and climate resilience in the city. This has been our research, and thank you for listening to us. I am joined by my fellow researchers Anilo Jesus Liwanag, John Lothar Dugui-es, and myself, Christopher Ramos Jr. Thank you for listening.